As always, thank you guys for joining us today. We've made it through the pandemic, having these regular calls, trying to update everybody on certain topics, whether they be commercial or in this case, regulatory updates. I think it's great that we're able to get Dr. Scott to join us today. Missed having him at the annual conference, but this update's always something everybody looks forward to, and it gives us a lot of good information and good guidance going forward as to where USDA is seeing their priorities on the animal identification and traceability landscape. With that, I'll take a moment and perhaps Linda and Neville, if you'd like to make some introductory comments, and then we'll get started with our program.
Well, I think this is really a timely presentation, and I can't imagine we didn't know at the time when we scheduled this how timely it would be. And Dr. Scott, we very, very much appreciate you making the time to do this, and I think for sure we'll get some really good discussion as we come out of this. So thank you very much.
And I echo Neville and Glenn's thanks as well. And if there is someone who has not been able or will not be able to join, we are recording this, so it will be available, because I know not everyone can make it, but it is an important topic. And we've been very much looking forward to hearing any and all updates from Dr. Scott. So thank you very much for joining us.
With that, if you could maybe move through the slides, Morgan. Or Linda, there we go. So we welcome Dr. Scott today, and most of you are very familiar with him. He's been part of our extended council group for years and years and years, been at USDA since 2002, and obviously, as you can see in front of you, a DVM and a PhD from Colorado State. He's luckily in that beautiful part of the country where he actually, as you see in the picture, loves to be in the outdoors. So unlike Oregon, where it's raining all the time, so I'm very jealous of where you're at there, Aaron. But for those in California, we do have a lot of moisture up in Oregon, so give us a shout. We can probably help you out with that. Without much further ado, I'm going to hand it over to Aaron and let him go through his slides. We will have time, Aaron, if that's all right with you, for some question and answer after your presentation. And I know people are looking forward to that. So Aaron, I'll just pass it on to you. And again, thank you so much for being part of our meeting today.
All right, thank you, Glenn, and really glad to be here with you all today. I do have some slides. I'll go ahead and share those right now. And that should be coming up for you very shortly. And Glenn, if you could let me know if you see that. Do you see my slide?
Absolutely do. Thank you.
Okay. All right. Great. Well, let's go ahead and get started. And for today, I'm going to talk about several different things. Won't be talking very much about the upcoming rule that we are planning to publish a little bit later on this summer, because it is currently with the Office of Management and Budget, and we can't say too much about it until it's published. We'll talk a little bit about it, talk about the program, but I was putting slides together and thinking about all of the questions that we get. Our animal disease traceability mailbox, our traceability at USDA.gov is a pretty busy mailbox, and we all watch that mailbox and get a lot of questions and a lot of things that come in from people. And so thinking of some of those questions that we get, I thought maybe the first thing I would do is start with some very, very fundamental basics. And these are things that most everybody on the call knows, or at least knows some or all of. But in looking at the questions we get, a lot of people don't know everything. There's lots of things that they don't quite get. So the first thing is that ADT, animal disease traceability, at least for our domestic species, our livestock, cattle and bison, ADT is pretty simple. There's just two parts to it. One part is identifying an animal, and the other part is tracking a movement document. And so if you look through 9 CFR Part 86, that's what it's all about. It's about the ID for our cattle and bison. Those are ear tags. And the movement documentation, which is an ICVI, or in some cases, it may be an owner shipper type statement that may have the same information on it, except not the health inspection. So those are the two pieces of traceability, and then all of the rest is capturing the data and using it and applying it and so forth. On this slide, on the very left there, those are official ID tags. The 840 tags, the one at the bottom is a brucellosis tag, an orange tag that is a metal clip tag. It is also an official ID tag. Put those in bangs vaccinated calves, but it's official ID. The tags in the center are not official ID. So I know probably there's a lot of animals that have been traced with something scratched on a tag with a Sharpie, like the yellow 30, the Y30 up there. And I have no idea how many hundreds or thousands of Y30s there are in the country, but those are kind of hard to trace. They're not unique. They don't really connect to too much. The middle tag is a back tag. Back tags are not official ID. They're used instead of official ID in circumstances where an animal doesn't need to be identified for very long. So for example, something going to slaughter, where they're going to wear that tag for a week or week and a half, and that's the end of it. And then the bottom cow there, I couldn't help but putting the old T-Bar X brand on it, which was the one that I grew up with, and I've put that on I don't know how many hundreds or thousands of animals when I was much younger than I am today. Brands are not official ID. They may be used if a sending and receiving state accept them. So other than the official ID tags, the state veterinarians can make bilateral agreements to move cattle with almost any kind of identification that they believe meets their needs and circumstances for their states. Now, on this slide, this is some pictures of some more different kinds of official ID tags. And so a few things about official ear tags. I was gonna have a quiz here and ask if anybody knew which one of these was a brucellosis vaccination, which of these tags was official identification for a brucellosis tag. Anybody know offhand which one of these?
That's a trick question.
Yeah,
You bet it. Yes, sir. Yes,
bottom
sir, it
left
is.
and bottom center.
Okay, and
I can answer it.
Go
ahead, Neville.
Any 840 tag.
Correct.
No matter the color.
No matter the color. And so we've traditionally used these orange metal tags as brucellosis tags, and I think they may even be in the brucellosis rule. But the tags in the lower left-hand corner, our companies have reserved those for us as orange OCV tags and even imprint the OCV on them. But it's not, as Neville well knows, they are official ID tags. They're 840 tags, just like the white ones above them. And either one of them may be used as an official vaccinate, but not both of them. So you can't put both of them in. If they've got a white tag on, you're allowed to put a metal clip tag if they're available, but you can't put a second 840 on. So on these tags, there's a number of different kinds. One point that I would make on these that's probably we haven't pointed it out maybe as much as we should, but if you look at the tag, two metal tags, bottom center, those are kind of hard to read. And if you're out in a snowstorm and those are covered with some of that stuff that's out there on cattle ears. Those are pretty darn hard to read, and they're not readable electronically. The 840 tags, before we approve them, one of the criteria that they have to meet is to be readable with 20/20 vision from 30 inches away. So if I hold my hand out about as far as I can reach, I've got to be able to read that ear tag from that distance visually. And that's visual readability, whether it's a visual or an RFID tag. Let's see, the other picture that I put in here in the middle, these are a new RFID tag that we just recently approved. And they're kind of unique in that they are a metal clip tag. I think these are used, if I remember right, in Australia a lot. But they have the RFID chip embedded in the plastic on it. So anybody who is really stuck on the metal clip tags, these are an RFID tag that's a metal clip. The next thing I wanted to talk about, another piece of the basics that people forget about a lot of times, is the jurisdiction. And so when we talk about animal disease traceability in our shop, USDA is responsible for interstate movement. So if cattle cross state lines, or if they're in a disease program, then they fall under APHIS jurisdiction. But that's not full traceability. So traceability doesn't work without our partners. So the states, the traceability within the states is under the state jurisdiction, state or tribal jurisdiction. And then don't forget the cattle producers and the private veterinarians, because they're a pretty critical piece of the whole, maybe not legal jurisdiction, but responsibility for tracking those animals. And if you put that in perspective a little bit, if we have a foot and mouth disease outbreak or something else that's in that level of bad, if it comes to me, I'll still have a job. I'll probably even be busier than ever as an epidemiologist. But a lot of the cattle producers are the ones that are going to be the losers. They're going to be the ones that take the brunt of the economic impacts of those diseases. So when we talk about jurisdiction and responsibility for traceability, we're kind of all in this game together, and it's pretty important to remember that piece, I think. So I wanted to walk through quickly the rule. So the traceability rule in Part 86 is the one that was implemented in 2013. Not very many changes are proposed in that rule upcoming this summer. There's a few things, but most of this will remain as it is now. So first of all, are cattle moving interstate? If they're not moving interstate, they're not covered under the rule. Are they beef cattle or are they dairy cattle? Because it makes a little bit difference on the rules that they are. And are they rodeo or exhibition cattle? Because those have different requirements. As you go down the list, for beef cattle, if you follow down the flow chart, if they are under 18 months of age, they require official ID and an ICVI, or I mean, if they're over 18 months. If they're under 18 months, they still require a health certificate, but not official ID. Dairy cattle, if they're steers, they require official ID, but not required to be recorded. Bulls and breeding animals require both. Now, there's some exemptions, a bunch of exemptions that make it a bit confusing. So on the exemptions to official ID, the primary one is number 4 on here, moving directly to a slaughtering establishment or directly to no more than one approved livestock facility. There's a few other places where animals are exempt from that rule, like moving from one state through another state to the original state, or directly to an approved tagging site where they would be, where an ear tag would be placed on them. or between shipping and receiving states with other agreed upon identification. So for the movement documentations, the same sorts of exemptions are there too. Movements can take place if they're agreed upon by the two state officials. They can go to a veterinary clinic for medical exam. They can go on commuter agreements where cattle are run, particularly in the West, across state lines, and directly to slaughter. So the next slide, though, this is one that our LPA folks always grimace at. They don't like gross, ugly pictures, and probably wouldn't put it to a general public presentation. But for us, I think it's important that we keep in mind why we have traceability. And traceability isn't going to solve all of our problems, even if we had the most ideal system in the world. Our poultry, which we've been hit hard with the last few years, poultry ID is not quite the same as cattle ID. Swine, cattle, both the foreign animal diseases and the endemic diseases like TB. These are diseases, I call them high impact, but they're really ones that could destroy our industry. They could wipe out our guys on the ground. This slide, this one, I take a step back and I look at it every once in a while, because this slide shows reportable disease outbreaks. I think this is the first half of last year, so I'm a little bit dated there, but it shows OIE reportable disease outbreaks across the world. And so if you look at it, not quite as many in the United States as there is in Europe or Asia or Africa. Some places like parts of Africa or Russia aren't very good about reporting the diseases. And some places have some natural advantages like Australia to protect their borders. But if you look at these and you think about each one of these, the diseases that go on the OIE reportable list they're pretty bad stuff. They cause a lot of damage and a lot of costs to the livestock industries. For some, if you've traveled any in Africa and looked at some of the livestock producers there and some of the Middle East, a lot of those animals live with things like foot and mouth disease and some other chronic diseases. They aren't very productive cattle. They even live and reproduce. They don't produce the quality and quantity of beef and milk that our cattle do. And the other sobering thought about this slide is that most of these diseases would be pretty easy to smuggle into the United States and start outbreaks in this country. In fact, I think it's a big kudos to USDA that we have not had very many of these diseases cross our ports and into our country. Huge challenge to block everything coming through. This next slide, just a few factoids here about the stakes that we're playing with. When we look at TB herds 20 or 30 years ago, it was expensive to take those herds out. TB is not treatable. You can test the herds and remove infected animals and clear up some herds that way. We use the model that we use to estimate the probability of being able to do that is one that I worked on back in 2009, I think it was, that we were looking at this and how we could maybe have an alternative to depopulating these herds. For today, a lot of our beef cattle and many, if not most of our dairy herds are very large. And if they get an incurable disease like TB, what do you do? And especially if it's a public health disease as well. So we end up with some huge indemnity payments on these herds to try to support the producers that have the cattle and eliminate the disease. But that gets up into the sometimes tens of millions of dollars, and it's in today's budgetary environment, that's pretty hard to sustain. If you look at the economics of foot and mouth disease, and there's a few others, foreign animal diseases as well, that could reach this level of cost, but these estimates are in the billions of dollars. These can have some massive impacts on our industries, and if we didn't stop them, we would be looking at long term of some pretty low producing cattle, some very poor productivity, and probably whether your cattle were impacted or not, the cost of the marketplace would be huge. The price of cattle would take a nosedive. On preparing documentation for the upcoming changes to the rule, we did a little bit of a economic analysis looking at what it would cost for RFID tags for the industry. And in that analysis, the cost to replace all of the visual IDs that we use, the metal tags that we have provided out there for many years, we estimated the cost of those would be about 2 to 2.5 cents per $100 of industry cash receipts. So there's some cost to them, but it's not that big of a cost compared to the impacts of some of these diseases. And I think that the fourth bullet there maybe hits me home too, because I grew up on a cattle ranch that was, I don't know how many generations, and until I bailed out and went to veterinary school. But if you devote your whole life to a cattle ranch, it's not just a business. It probably should be more of a business than it is, but there's a lot of emotional attachment. There's a lot of lifestyle. There's a lot of history in there. And we don't include that in our cost estimates. We don't do those in our impact analysis. But when we look back at the UK and the turn of the century, some of those folks were devastated. Many committed suicide and some other really horrible things just because of the emotional impact of seeing everything they'd worked their life for going down the drains. So once again, traceability is a tool. It's not the only tool, and it's certainly by itself is not going to solve all the problems, but it's certainly important if you're trying to find animals that have been exposed to disease. Now, this is the last of the basic slides I think I have. This is one from our emergency management response system database over the last, I think this one was 10 years, 9 years. These are FAD investigations, and these would be investigations done by state or federal officials. And if you look at these investigations, some of these last 4 or 5 years are related to some of the poultry disease outbreaks. But if you look at the number of these investigations and the number of things that are going on, these are all species, all foreign animal diseases. Foreign animal disease is one that has not been previously or is not known to exist in the United States. That's kind of a scary graph. And if you look at those in 2020, 2,570 investigations where no FAD was found and 148 where there were actually FADs, that's a little concerning. We really need to think about that and wake up to the fact that we do have things coming. We're outnumbered. There's a lot more foreign animal diseases than there are of us. So let's talk a little bit about what we are doing in our ADT program. The strategy on the left, you see the electronic data, electronic ID, birth to slaughter tracking, and electronic documents. Those, you've seen those half a dozen times before. Those were the 4 key goals that Undersecretary Ibaugh distilled down from what we had presented to him in strategy. And he encapsulated that vision pretty well with those four things. To be able to trace animals more effectively in especially the 21st century, we have a lot of cattle out there and other animals too, but a lot of cattle. And tracing all of those animals with a paper and pencil is pretty tough. It's pretty hard to get where we need to be. So our strategy is really pretty simple. We need to increase the speed and accuracy of tracing. And in doing that, we need enhanced data capture and storage and retrieval. And so I'm not talking about who has the data and who stores it and so forth. It's just the people that need to act on the data need to be able to have it in hand. We get lost in the weeds with a lot of livestock producers on who owns the data and who has it and who shares it and who should have it, when should they have it. The answer to that is people that are able to do something about disease are the ones that need to have it. They need to have it quickly and they need to have it accurately. So what are we doing to try to implement that enhanced traceability? And so we've got a lot of different projects and things that cross my desk all the time, and trying to implement a number of things. The first one was funding. We don't have a lot of funding. Budget has been tough. It's hard to find the money for things, and for particularly anything we don't have a specific line item funding for is kind of like knocking on doors and shaking piggy banks to try to find it. We have, in the last 3 years, found money to buy tags, to put tags in ears. We found a little bit of money to put readers in some markets and in the hands of some veterinarians. We've put some money in partners' hands in states and industry groups to do some exploratory pilot projects to try to build our traceability system. Outreach, that one's a pretty big topic of outreach from meetings, which we've been kind of restricted from meeting with folks due to the COVID in the last couple of years and the travel restrictions. So we have breached some of that with Zoom meetings and otherwise. We've also posted some public notices and asked for public comment, and posted a few other things. The third one is metrics. We measure the traceability system. I think I have a couple slides on that, but we measure how well we can trace animals. We've invested a lot of money, I don't know how many millions, but a lot of money in APHIS and modernizing our IT systems, and also in creating the background mechanics, the software to move electronic messages safely, confidentially between IT system. And then, of course, the regulation that's coming later this year, the proposed regulation. So as of May 1st, we have purchased and distributed 12.4 million RFID tags to the states. We have either distributed or will have available up to 8 million RFID tags in 2022 for the states. We have, over the last 3 years, we have found, I smile when I say found, but that's kind of what we've done, is found a little bit over $1.5 million to put readers in markets and for veterinarians. We have had 3 companies bring tags forward for approval and have met all the requirements for a USDA approved RFID ear tag. And then every year we provide about $6 million in traceability cooperative agreements to the states. The 6 million is in addition to is specifically targeted for traceability. It's not for any of the other disease programs or operations that they have. The pilot projects, we've talked about those before, and some of you have been involved with those. The vision on the pilot projects, the money was earmarked to use UHF back tags. And with some very creative folks, I think I saw Ken on there joining the meeting, but some really creative folks in some of these pilot projects in working through how they could use the funding to achieve some of those goals of enhanced traceability. So some good results on those, some interesting things have come out. I think we all heard Dr. Schwartz in Texas talking about some of the Texas pilots and how they had used the UHF tags in their markets to move cattle through the marketplace a lot faster, less staffing, less work, and then put long-term ear tags in them after they had traversed the market and incorporated those data systems. So some good stuff that have come out of those pilot projects in that goal of making our traceability faster and more accurate. I'd like to talk just a couple minutes about our trace exercises. And since the implementation of the 2013 traceability rule, we've measured or done the best we could to measure the effectiveness of the program. And so that first year before the traceability rule, the time to do these 3 traces was 490 hours. That was an average across the states. The 3 traces are the combined average time of each of the 3 traces. They are, those 3 would be the combined time of where an animal was identified, what state it was identified in, and if it was imported, where it was imported from. By the end of the first year, states were getting much, much better. They had kind of learned the ropes. They were, their staff had learned how to do it a little bit better, and that average time was 123 hours. And so that steadily improved until the 6th year of 11.5 hours. But as we went forward, 11.5 hours is pretty good. That's getting up there. That's attributable to states using electronic ID and electronic databases to do searches, and staff having a little better understanding of how to do the traces. But the flaw in these trace exercises was that the way they worked was that we would give our state partners a tag number and say, here's a tag, go trace it. And so they would take each of those traces and go try to find them. The flaw in it, though, was that if it happened to be a time when all of your staff was out sick or was busy doing real disease control or something like that, then the trace exercises would go in the back burner. So what we did the last 2 years is we initiated the trace performance metrics, and we call them national priority traces. And on these, we reduced the number of traces that the states had to do by quite a lot. So it relieved a good bit of the burden on the states. But it also asked the states, when can you do this trace and treat it like a national emergency? So the way it would work is we would reach out to our state partners. We'd say, hey, we want to do a trace exercise in your state. When's a good time to do that? When could you really treat this like an emergency trace? And so then the states had come back and say, well, you know, this week is really, really bad. We can't do it. But maybe next Thursday we could do it. And on Thursday, they would all be, I envision folks with their sleeves all rolled up and all ready and eager to go. And so they get their tag number and do the trace. And so this table lists all 4 of the traces. And for both the 7th and the 8th year, 7th and 8th year would be last year and the year that just ended in April. The time on those, the average time across all of our state participants is less than an hour for each of these traces. And the median time, which is the time that half of the states were below and half above, if you look at those numbers, that's pretty impressive. Our states are able to find these tag numbers, most of them, in like about half an hour. That's the kind of time that will save our country if we had a foot and mouth outbreak. That would give us the ability to get ahead of some of these diseases. Caveats are that these are interstate movements, animals that are on a health certificate or a TB test chart or something like that. And these are all official ID tags. That does not reflect RFID, although if you think about it, if it's an RFID tag, the data goes into the database accurately. If it's hand entered from anything else, any kind of visual tag, then it's a lot easier to make those fat finger mistakes and make the errors that would go into them. Let's see. Next slide. I won't talk very much about the enhanced data systems because I'm pretty familiar with most all of them, but I don't work on that directly. The first one is the messaging. Messaging, the interoperability or messaging data is the background software that takes any kind of information, encodes it or encrypts it in a way that it's not hackable, and then fires it to another data system. So that takes some background software to do that. And then I guess a simplistic way of thinking of it is that at each end of the message, you are connecting to that carrier. The second one I've talked about, you've all heard about it, I think, a number of times. That's our AHER data system. AHER is a data system that only holds like 5 data points to carry information. It carries no producer private information, but it allows the officials that are trying to do a trace to log in and see when an event occurred, where it was at, what state it was in, at least, what state contact and state official would hold the permission to gather additional information into that. AHER has, I don't know how many records, but it's in the ballpark of like 500 billion records. It's huge, billions and billions of records in there, but each one of those only has those few data points. It's a compromise. It's not database at your finger to find everything you ever wanted to know about a trace, but it combines the IT system, a rapid index to find where data resides, with the partnerships to complete the traces. Third bullet is, this is the upgraded MIM system. The MIM folks have had a little bit of contractor issues, I think, in getting completed, so they're a little behind schedule on that. Helps to manage the outbreaks and also eventually will have capability for ECVIs in it. The MICO apps, the electronic forms, the ones that I'm involved with mostly are the approving livestock markets. So when I came into this seat, livestock markets, our folks would meet with the livestock owners, the folks that had the markets. They would sit down and make the agreement for an APHIS approved livestock market. And then everything traveled with postage stamps and envelopes and paper forms. By the time those got to me, I think I'm fairly sure they could have come a lot faster with carrier pigeons or Pony Express, because some of those I would see crossing my desk to sign that had been in the system for literally months. They would go to the veterinary services area office. They would go to the state office. They would travel eventually through all these routes and take a long time. We fixed part of that problem by allowing people to sign them electronically and send them by email. So that was the first step, and that worked pretty well. That reduced that time down a lot. Today, these electronic market agreement approvals could be at the market, at the livestock market this morning, make the agreement, sign off, send it electronically, and be on my desk and signed this afternoon. So literally some of these, I have signed them within hours. And it's not uncommon to get a panicked message from one of our AVICs that says, hey, we have this market and they have a sale scheduled for the weekend. We need to get them approved and have that paperwork moved. So that's pretty exciting. We're in the process. We have contracts for updating all of our animal disease traceability information systems. Those are progressing. I'm not sure the completion date on those and some of the things. The ADTIS system would be our tag manager system. It would be our allocator for the Prim ID numbers and the tag numbers. So that is in the works. It's been in process for a year now, and I think they're going to have some deliverables yet this fiscal year, and then some completion coming up in the next fiscal year. See the next slide, just a couple of fun slides, I guess. If you Google PIN plus APHIS, you'll come to this map. One of the things that we realized was that if you need a PIN in whichever state that you're in, some states are really great. Their databases are good, and they're easy to find and easy to search. And a few states are pretty darn hard to find where to go to get a PIN. So we put together this interactive PIN map. If you Google PIN plus APHIS, you'll come to the map and you can click on your state, and that will give you a link directly to the state office where you can get a PIN. I think the hits on this side are around 1,500 a month. So we're having quite a good bit of traffic on these. This one is another one. If you Google approved livestock market, you will get to this map that shows you all the approved livestock markets. And these are APHIS approved markets. They're shown on the map. It's interactive, so you can click on whatever species that you may need to have, and it will give you also a written report on the information on those livestock markets. So a little bit of support to our livestock markets out there. And then this is live. If I sign an approval for a livestock market this afternoon, it will be on this map tomorrow. Regulation. So I said I wasn't going to talk very much about the regulation, but I'll give you a few things and hope that you all put some comments into this when it's published for public comment. We're modifying the rule. The main change in it is to require all official IDs to be readable both visually and electronically for cattle and bison. Visually, again, is at arm's length and clearly readable. The tags, as they are approved, it's a fairly rigorous approval process to ensure that those tags are, of course, unique tags for the animals, but also performance and retention at very high levels for the lifetime of the animal. That is in process. It's been through many hoops and different parts of USDA for clearance. It is now with the Office of Management and Budget. They have a few more questions and clarifications for us. I think actually this week we're meeting with them again. And then the target for publishing that is later this summer. We don't have a date. It'll definitely be after July, but we don't know exactly how much longer after that. And then the rule that I walked you through earlier, not a whole lot of changes in anything else in there. There are a few definitions that are clarified and a few things that are policy type things that are a little hard to understand when you read the CFR, and hopefully we've clarified some of that language. Next steps after we publish that rule will be the comments, the decision on the rule, the implementation of it, hopefully sometime in 2023. It will not be January 2023 as we had hoped in some previously NIAA meetings, but we're still looking at some point during that year. Meantime, we are still providing the RFID tags to the states, trying to find money to continue supporting our markets with the readers and reading systems, continue to do outreach, continue to support our state partners, and eventually, after if this rule goes through and is implemented, there'll be a warm-up time, and then eventually compliance actions that go with it. So I think that is the end of my presentation, and I will try to answer questions if I can, and if I can't answer them, I'll pass them on to somebody much smarter than I am to get back with you. So back to you, Glenn or Morgan or Neville, whoever's running the show there.
Aaron, thank you so much. So we still have a bit of time, and I'd like to not waste anybody's time and get straight to the questions. So if you guys prefer to just jump in, just unmute, your microphones and just jump in with your question. If you prefer, just send a group message to anybody, to the group, and we can just read it that way. So whatever you prefer, but don't be shy, jump on in, and let's open up the floor for questions.
Hey, Dr. Scott, Baron Copes with Merck. Good to see you again.
Hey, Baron.
I feel like I just saw you yesterday, but I did.
Yeah, I was going to say it hasn't been very long, has it?
No, question for you. As we look at funding, right, moving forward, especially with a farm bill coming up, as well as, there's just a lot of money, right, over the last year or so that's been out there from USDA for other programs, small and medium processors. And I know there was some funding for High Path this last week or 2 weeks. Is there something that we can do to help either, get dedicated funds, right, that are either earmarked or, a line item in the budget for traceability, so that states know what they're getting and know that there's going to be, what amount is going to be there for them to apply for or utilize, or even, ask for an increase, to build out infrastructure and tags and everything else. Because, I think as that rule comes into effect, right, if the funding's not there, there may be a struggle to fully implement, just because you might run out of funding or you may not have it. So any thoughts on that?
Yeah, a couple thoughts, Baron. And the funding process, we put forward budget requests. Congress, of course, allocates the budgets. When it comes down to APHIS, APHIS has a lot of priorities. There's a lot of things that our agency does for animal health, and not all of it veterinary services either. So when the money comes to us, we try to prioritize it. We try to put it where it needs to go. If traceability is a high priority, it gets money, but it's always this challenge of where to best spend the money. So we don't have a line item for traceability. We do in our budget, our traceability budget, we have that cooperative agreement funding that goes to the states, and it's not an APHIS line, but it is in our, I don't know how to describe that one, but it's within our budget every year. So that's pretty secure money for our states. The additional money, like for instance, for these RFID tags, that's not a line item. That's money, I think what we're just preparing to put out another solicitation to get up to our limit of tags for this year, that money has come out of other parts of veterinary service APHIS funds. So it's come from cattle health, it's come from a number of other places. So yes, if there's a line item that would secure funding each year going forward, it wouldn't be this. I guess it's just been the last month or two that we finally got secured funding to buy the ear tags for FY 2022. We're within 3 or 4 months of the end of the fiscal year. So the answer to your question is I think the way that funding is allotted, it does make it difficult to make long-term commitments for funding.
Dr. Scott, I've got a couple of questions from Dr. Robert Fordrain, who had to drop off the call, but I'll ask him on his behalf and then basically let him come back to the recording and take a look. His first question was, where do dairy beef cross calves fit under the programs? Do they fit under dairy or do they fit under beef?
If you go back to the original 2013 rule, that's really vague in the rule. It's not real clarified. And the rule says that it's dairy cattle or dairy breed cattle. But if you think about the reason for traceability in dairy cattle, the differences from them from beef, is that if you have a dairy, your management, your operation practices are way different than a cow-calf producer, for example. So you have calves, you maybe pool colostrum to feed them. Hopefully your pasteurization systems work well. You commingle those calves and then you send them to a calf raiser or to another facility, or maybe eventually on to a backgrounder or something. And so those calves move a lot of different places, a lot of different locations. So the traceability on them, whether they're a dairy cross or a dairy animal, traceability is the same. So that dairy cross animal then, as far as disease risk and need for traceability, is the same as the dairy animal. So that would be the answer for him. Policy-wise, we have treated them the same as dairy. We'll see what folks think when we publish the rule as far as managing those, what comes back on those. But that's the reasoning for it's not that dairy cattle are more susceptible to diseases than beef cattle at all. It's the way that the dairy cattle management, the way that you would normally manage them.
Yeah, makes sense. Robert's second question had to do with validation or the ability to validate 840 tags. And the context is in the dairy industry, when they're doing genomic testing and genomic evaluations, they submit information on the animal using its 840 number as the unique identifier. Right now, there's no means to exists to validate an 840 number actually exists or is assigned to a farm when first reported. Causes the second time that somebody uses that number to be rejected. So as an example, if somebody like me would fat finger in an animal for evaluation as an 840 1 2 3 4 5, and that was an erroneous number, but then somebody actually bought that tag and tried to go in and do an evaluation, it's rejected. And it's clearly an industry problem. It's not a USDA problem. So I want to be clear on that. But there's no source for the industry to go to and validate who is the actual owner of that number. So if somebody erroneously uses it and somebody that actually has the tag and is invested in their system to identify an animal with an 840 tag can't use it, now people are saying, well, there's really no value to the 840 system. So they're looking for some mechanism, and really the only mechanism to validate 840s in my small mind would be some interaction with USDA. So that's the general question. I don't know if you've got some guidance or any discussion we could have on that.
Yeah, I do, Glenn, and I mean, we've had we've had it come up before with not with the dairy industry scenario, but in other circumstances where a tag was fat fingered into a database or something like that. I guess two parts to the answer. One is a question of how often if this is not a huge number of, well, I guess we would like to know that anyway. If there is a tag number that it's a duplicate showing up, we want to follow up on that. If it's a huge number of those, then we may have some logistics to figure out how to do that. But what I would, I guess what I would offer is that Robert would reach out to either to me or to traceability at USDA.gov, and let's sit down and solve the problem. Probably not going to solve it on this particular meeting, but it's an important problem, and it does show up, and not just for the industry's inconvenience of having the tag rejected, but the concern with traceability if we have a duplicate or something like that. He's more than welcome to reach out to me directly, or the traceability box. All of my staff watch it and are on it, and we can set up a time and work through some solutions.
First class, thank you. I don't see any further questions on the chat.
I've got a question, Glenn.
Oh, Stu, please jump in.
Yeah, I'm just wondering, sorry I was late to the meeting and I'll look at the recording, but I had a question. Is the USDA able to secure sufficient numbers of RFID tags today? Are they getting everything that they want and need?
So far, we are getting all that we've ordered on schedule, on time. The next order that goes out will be, I don't know for sure how much that is, but there'll be another order going out within the next, hopefully this week, but if not this week, then very soon. I don't know how those supplies will be for the next order. I guess you guys could tell me more than I would know, but so far we are getting the orders that we have. They're I think coming in some chunks of tags between now and I think the final ones are due the 22nd of June, I believe, is the end date on it.
Okay, a follow-up question would be, do you expect this cycle to continue, that there will be solicitations for RFID tags this time of the year every year, or do you expect to change that and there maybe be 2 yet in 22?
There won't be 2 in 22. There'll be 1 more that comes out in fiscal 22. Fiscal 23, I hesitate to even say anything about because of the way the funding comes. We are anticipating putting out a solicitation in FY23, which begins in October. But you've seen the federal budget, so it's kind of hard to predict what will come next year.
Is there any resource available where people can go to see where tags are going?
I don't know, Stu. I know the states, you can kind of roughly estimate the states. The way that the state allocations go, each state gets a number of tags that's proportionate to their cattle population.
Right.
Some states, there's a few states that don't participate.
Right.
So, and some states take all that they're allocated and some don't. As far as a specific detail, I don't think there's any place you could go and look and see who gets what.
Okay, thank you.
Let's see, Glenn, I see a chat box there from John Nelson. Hi, John. Question is, what is the cost comparison of the newer metal clip RFID tags to the button tags? I don't know what the cost is on those. I know one of the three companies had sent out an advertisement on their new tags for $1.75 base priced on their RFID tag. I don't know whether that was the metal clip ones or one of the other buttons, but I know they are the metal clip ones. That's I think the company is Leader Products, and it's what's it called? Easy ID, I think, or something like that. And I don't know whether those are available just yet or not, and I don't know for sure what the pricing is on them.
Aaron, as a bit of a follow-up on that, is there an updated site where you have all the approved devices? Because I've seen the site recently and it didn't seem like it was refreshed with some of these new entrants.
It is happening as we speak. Right now we're struggling with staffing, but I've got one person, Dr. Krasolinik, who is just one of these people who's just a dynamo, and I'm terrified that she's gonna take on so much work that she's just gonna like collapse in a puddle sometime. But she is working on that. I know Barron at Allflex has helped us. Datamars has helped us out. I talked to Stu a few days ago. He's working with her from YTEX. So I don't think she's posted the updated list, but it is almost done.
Okay, thank you. All right, I don't see any other new questions. So last call to the group. If you have any questions or comments, please jump in now. All right. So, and Aaron, the timing of the, I guess the comment period opening up, you expect that to be sometime this summer?
The timing on that, OMB is the last hoop to jump through. OMB typically has about a 90-day review period, and they got it the 1st of April, I think, which the bare minimum would be after the 1st of July. They had some questions, some comments that we addressed. We're still going back and forth with them. So I don't have a date. It will be after the 1st of July. It could be sometime in July, or it could be later on in the summer or fall. So that's about as close as I can narrow it down.
Yep, that works great. With that, I'm going to kick it over to Linda and Neville. Any last questions and comments from your side?
No, other than Dr. Scott, this is really helpful. It's always good to get your insights into what's going on, and you're a champion to spend an hour with us and do this. Thank you very much. Super, super helpful.
Thanks, Neville, and thank all of you guys. I truly enjoy visiting, and certainly enjoy visiting one-on-one too. So always here. So thanks, everybody.
Thank you,
We
Linda.
look forward to having you join us once again, maybe later in the year, once everything is moving forward once again.
when we know what we're doing and talking about.
Yeah.
By the way, Dr. Scott, we are not afraid to wear out our welcome.
That's true.
That's fine, and I'm not afraid to tell you what I think's going on, as long as you realize I don't have a clue most of the time.
That's not true. Thank you very much for your time and all the great information.
Hey, Morgan, for those that want to review the recording, where would that be available?
So I will do that this afternoon. It takes a while to download and then to upload to YouTube, but you'll be receiving an email shortly after this, if not this afternoon, then in the morning, to get a link to the video if you want to review it, and for those that weren't able to join us. And then there will also be a link for a survey. Right now, I've got some save the dates up on the screen. If you want to have a look at those, we've got a virtual coffee. You don't have to bring coffee. We just say that so that way it seems like something that you might want to attend. It's very informal member meeting. If you want to come, if you've come already, you won't be receiving any new information there, but it's just kind of a review of things that we're doing, things that we're working on, and some of your benefits as a member. We've got the 12th Annual Antibiotic Symposium in Alexandria, Virginia, coming up in November. Registration's open for it, and hotel room block ends on October 11th. That's a long ways away from today, but it will be here before we know it. So if you have any questions, feel free to reach out and I will get you the link that you need. Lastly, I think we just confirmed this within the last week or so. April 18th through 20th next year, we have our annual conference dates already solidified, and it will be in Kansas City. So we got a lot of feedback that people wanted to go back there this coming year. So that's where it will be. And then we'll figure out where we want to have 2024 after that. And I think, hold on, all of these fun little windows that come up. Of course I can't. Oh, whoop. There is the link to the survey. If you want to pull up your phone and have a snap of it, that'll take you directly to the survey. If not, you'll be getting a link. So if you can complete that, we love hearing your feedback. We do look at it, and Glenn and Neville and Linda get to see some of the responses that you leave. So we really appreciate it. But that's it for me.
Very good. Well, again, thank you all for attending. We will be communicating again the next meeting. We'll try to continue this over the summer with a little bit of a cadence. So kind of watch your emails for that. Wish you guys all a great start to summer, and be safe out there. Thank you all for joining.
Thank you.
Thank you. Bye-bye.
Take care.